Using simulation in enhancing communication skills in practice.
First of all, you need to develop your simulation storyline by describing the scenario, identifying critical events, outline the information that the facilitator will provide at different points during the simulation, making sure the activity supports the determined learning objectives. Your simulation story need to be representative of a realistic event that could happen. Moreover, it would be very beneficial to have other stakeholders/colleagues, or your committee, review the storyline to ensure that it is realistic and supports the learning objectives of the course and the activity. Finally, with developing your storyline, you need to prepare any required materials such as descriptions of the conflict and/or context, and descriptions of character roles for the students and/or actors. Prepare supplemental materials, if needed, e.g., investigation results. Also, you need to generate a list of anticipated questions from students. Let us take our case as an example. Heppen is 35 years old, beauty therapist, married, and have 2 children. Woman. She had been diagnosed with triple-negative breast cancer late in 2020, before going on to have surgery. Her treatment was initially successful, and for a number of years she led an active lifestyle. Few days ago, she started to notice a change. She was feeling more tired than usual, yawning and flagging easily, she explains. After undergoing further tests and scan, and the news was not good. Investigations assures that the cancer had returned, this time spreading to lymph nodes in her armpit and possible disease in other parts of her body. She needs more treatment, but this time with chemotherapy and radiotherapy. Now you can list some possible questions such as, what if she is worried about the continuity of her work? What if she is worried about the continuity of her exercising activities? What if she asked about her social activities during the treatment? What if she asked about alternative solution for the treatment? What if the family planning to travel, especially summer vacation starting soon? How long have I continued the treatment? What if she has worries about seeing her children growing? What if she asked about approaching other hospitals for second opinion? Next, we need to assign the responsibilities. Patient, standardized patient who will represent the sick lady in the scenario. Healthcare provider, a doctor who need to deliver the news for the patient. The student's role as a doctor, ensuring that you are meeting the correct patient, establish rapport with your patient, explain the purpose of the interview. Use spikes is an effective way to structure the breaking bad news consultation.
Very useful to pilot, refine the simulation-based learning activity with a group of students who resemble your intended students, using the storyline created. This process is useful to identify potential issues in advance, make necessary modifications, and refine the simulation-based activity.
Simulation is an effective experiential learning. The simulation-based learning activity must be planned within an experiential learning framework, with guided and structured reflections and pre-brief and debrief meetings.
Briefing stage. Conducting a pre-brief and debrief is foundational for any simulation-based experiential learning. The pre-brief prepares learners for the experience and the debrief helps them reflect on the experience.
Pre-brief. The pre-brief meeting should present a quick overview of the simulated learning experience. It should cover the key components, the goals and objectives of the exercise, logistical considerations about the activity, and introduction of all participants, students, facilitators, or actors.
Timing. The pre-brief can occur 1 to 2 weeks before the simulated learning experience or immediately before the learning experience, depending on the learner's previous experience with simulations.
It is important to provide an overview of the learning objectives, both academic or technical and workplace-related ones, and clarify any questions that learners have about the simulated exercise.
The objective of the simulation exercise is to prepare healthcare students for conveying difficult news to patients and/or relatives. The purpose of our simulation activity summarized in, at the end of this activity, you will be able to determine what the patient knows about the medical condition or what he suspects, transmit the medical information, provide support to the patient, identify the emotion expressed by the patient. We have assigned the patient role to a standardized patient who you will address the issue with him as a real patient. Each student will be examined alone in how he can convey the bad news using Spike's model.
It is essential to remind learners whether or not they are being assessed for this exercise, and if they will be assessed, to discuss the assessment method and procedures briefly.
Psychological safety and comfort is a very important topic which needs to be taken into the consideration. Facilitators need to acknowledge that the simulated learning experience might be stressful and that it is okay for learners to make mistakes and experience a variety of emotions during the simulation. Facilitators have to discuss the confidentiality of the exercise. You may want to suggest that if learners discuss anything outside the simulation setting, it should be limited to the lessons learned rather than the performances of specific people. Facilitator will be available for any intervention required during the scenario. We'll record a video. This video will be used for assessment by an evaluation committee and reflection on students' performance. The simulated learning experience might be stressful and that it is okay for learners to make mistakes and experience a variety of emotions during the simulation. Do not forget it is just a learning experience. Also, I want to remind you, if you are going to discuss anything outside the simulation setting, it should be limited to the lessons learned rather than the performances of specific people.
Role of participants and facilitator. Before starting the simulation, it is important to ensure all learners are clear on their roles. Thus, in the pre-brief, make sure to cover the roles of the learners and the facilitator in the simulated learning experience.
The student's role as a doctor, ensuring that you are meeting the correct patient, establish rapport with your patient, explain the purpose of the interview, use spikes is an effective way to structure the breaking bad news consultation. The course scenario sent to you 2 weeks ago and the Spikes guidelines have been taught to you in Breaking Bad News session at the beginning of the semester.
Finally, in the pre-briefing stage you need to provide an overview of the learning environment. This could include any necessary materials, required technology, overview of the setting, and description of available resources.
Private room, some tissues available, chairs for you and the patient and 2 extra chairs if the patient wants someone else to join. Take with you the file of the lab results and imaging report and images. Also, it might be useful if you have pictures or short videos on similar cases to explain the case and its consequences with audiovisual similar examples.